this is the so here we are going to check the visual difference between the CT, means computed tomography, and MRI, magnetic resonance imaging. So in this diagram, the first diagram, this is the computed tomography radio imaging, and how we can identify that during this type of scanning or radiography, the outer margin, this is the bony part, which is very thickened and having white contrast, and in the mid area, the whole structure, that is the internal structure, and at the different sections of the brain with like different spaces, different parts, the thalamus body, the ventricles gap, and other structures. And this image, this is the MRI image, magnetic resonance imaging. How we can identify that this is the MRI scannogram? On the periphery, there is a thin layer, thin white reflection, outer layer of the bone, outer part of the bone, and the inner structures. These are the soft tissues and different cavities, and with different lobes, all visible. So here we can visually difference uh, between the CT and MRI, that the whiter appearance, thick whiter appearance on the periphery, it is the CT part, and the thin outer line with the inner soft tissues, cavities with fluid with white contrast, these are the uh, under MRI. So this is the visual difference of CT and MRI. Now we will check the difference and purpose of this both CT and MRI. So in the CT scans, computed tomography, it is usually a type of X-rays to create fast, different cross-sectional images at different level of the brain, from top to sequentially till the deep layer, and making them ideal for different conditions during the emergencies. And we can also check the or observe the different fractures or trauma, or we can also observe the internal bleeding conditions. So this can be happen in the CT, computer tomography, and in the MRI, magnetic resonance imaging. So these are used with the strong magnetic and radio waves, providing multiple unparalleled detail of different soft tissues, different parts of the brain at different level, and we can also observe if there is a smooth muscular part available at any level. We can check, or any ligamentous structure, but it can be take significantly longer time in the MRI. And here some key differences between the CT and MRI. Let's check. So the key differences at a glance, like on the basis of technology, the CT scan, these are under the CT scan, the type of ionizing X-rays are used. But in the MRI, the magnetic fields and radio waves are used. For the best performance based, the CT scan, it is used to observe the structures like bony structures, and if we do the CT scan of the other parts of our body, so we can check the viscera like lung during the acute trauma conditions and detecting the internal bleeding hemorrhage conditions. And in the MRI, it is especially used for the brain, the spinal cord, and muscles, ligaments, and other cartilaginous structures of different parts of the body. On the basis of speed of this X-ray scanning, CT and MRI in between, on the basis of speed, in the CT scan, very fast, typically almost 5 to 10 minutes taken, but in the MRI it will take some slower time, means it take more time, often 30 to 60 or 70 minutes it can be. On the basis of radiation in the computer tomography, yes, radiation is present during this CT scanning process, but during the MRI process, the radiation is almost nil. On the basis of noise during this CT scan, relatively very quiet noise is present, but during the MRI process, very loud and require ear protection during some situations. On the cost basis, the CT $500 to $3,000, and during the MRI almost 1,000, 12,000 to $4,000 to $5,000, means it is more costly as comparison to the CT one. So CT, because of its speed, it is the first line of choice during the emergency conditions, emergency room. Strokes in the first few hours, you can check with the help of CT scan, detecting the different complex fractures present inside if it is happen, chest conditions or any abdominal injuries. And during the MRI, doctor rely on MRI because for evaluating sports injuries, diagnostic neurological conditions like multiple sclerosis or tumors is present inside the any part of the brain tissue, and seeing the spinal cord or soft tissue if there is any damage occur inside. So both are very important, but CT is more preferable and less costly, and MRI it is also preferable, but it is somewhat more costly. So this is the key differences between the MRI and the CT scan. What happen if during the high density tissue is present and when the low density tissue is present? During the high density of tissue is present, when just like bone, it is high density structure, absorbs the radiation to a greater degree and reduced amount is detected by the scanner on the opposite side of the body. And if low density tissue is present, such like brain tissue or any other viscera of your body, just like lung and any other, it absorbs the radiation to a lesser degree and there is a greater signal detected by the scanner. So this is the performance difference between the CT and MRI on the basis of high density tissue and the low density tissue. During the MRI, because it is somewhat very complex as comparison to the CT, there are many factors that lead to production of final MRI image. Having different combinations of this will be used for different clinical presentation. So, some examples of common images and sequences, like we can differentiate the MRI on the basis of T1 weighted and T2 weighted imaging. What is T1 and T2 weighted imaging? It is the difference based on the timing of radio frequency pulses. Like T1, it is the radio frequency pulse when the tissue is very bright, and the fatty tissue on the periphery, it looks somewhat bright in layer, and the, like in this, see in this diagram, like bright in layer, see in this diagram, the tissue in the periphery is somewhat bright, and on the T2 based, T2 weight based, the water present inside the cavity, it also appears as a white fluid like. So there is a T2 weighted and T1 weighted. We can see again a different image to check the proper difference between T1 and T2. So in both these diagrams, in T1 weighted and T2 weighted, based on different timing of radio frequency pulses. In T1, in case of T1, we can see that the periphery, the layer of fatty tissue which is present some sides of the brain surface, it is bright in appearance, and the other inner structures having very less contrast, but all the structures are visible. Like in the middle we can see the corpus callosum, in the vertical part that is the septum pellucidum, on either side that is the lateral ventricle cavity, slit, and thalamic body, the temporal lobe, the occipital part, the frontal, everything. And in the T2, so in the case of T2, the again the different timing of radio frequency if occurs, then this is the T2 weighted imaging. In this case, we can see again the lateral ventricle, inside to this lateral ventricle, the fluid which is CSF, the water part, it is again, it is white in appearance, but in T1 it is blackish because of the difference in the timing of the radio frequency pulses. So in the T2 cases, we can see the lateral ventricle cavity having the fluid and its white contrast appear, and on the periphery a thin layer of fatty tissue, again it is somewhat bright in color. But this is the main difference between the T1 and T2, that on the basis of timing difference of the radio frequency pulses in the MRI condition, we can differentiate the different imaging on the basis of T1 and T2, and we can identify the structures in case of T1, why there is a bright fatty layer, and by the black appearance in the lateral ventricle, and other soft tissue light gray, and in the T2 case, the ventricle cavity having fluid, but it is white in appearance and bright, and outer layer, the bright fatty layer, is again it is present. So this is the condition of MRI based on T1 weighted and T2 weighted images. Finally, between the CT and MRI, the CT, it is called computed tomography. especially used in these x-rays, ionized x-rays, and it is based for bone identifications, bony structure identification, blood vascular structure, steering trauma, and any other acute emergency bleeding or a stroke condition. And MRI, especially, it is called magnetic resonance imaging. In this condition, magnetic fields radio wave used best for soft tissue uh, observation. If there is any tumor is present, we can observe, or any malformation, and it is especially concerned with the different function of the brain. So you can remember the difference between CT and MRI. CT, it is related with the speed and bones, and MRI, it is concerned with detailing of the structure with soft tissues of the uh, brain, or it can be MRI or CT on your different parts of your body. So this is the basic differences of CT and MRI, and every first year student uh, they can understand these basics very clearly. And thank you for the watching.